Good morning, everyone. Thank you all so much for joining us today. We're just going to give everyone a moment or two to come into the room to join us. Please feel welcome to say hello in the chat box and let us know where you're joining from as well. So thank you all so much for being here today. My name is Amy Staley, and I am one of the Immunization Advocacy Champions at the Nursing Now Challengers Committee. I'm joined here today by the incredible Rafayette, Rashid, and several of our other immunization advocacy champions. Today, first, we will be hearing from Vince Blazer, Director of Advocacy and Outreach, Vaccine Acceptance and Demand at the Sabin Vaccine Institute. Later on, we'll be breaking our own voices out of silence into an incredible breakout session. So we hope that you'll all stick around to take part, and I'll hand it over to Vince. Thanks so much for being with us today.
All right, thanks, Amy. And I know some folks are still filtering into the webinar, so really appreciate everybody joining today. And we're really excited to be working with the Nursing Now Challenge and all of these wonderful advocates to be launching a new challenge on immunization advocacy. So I'm just going to talk. I'm going to be talking a little bit about why we're doing this, and so just going to share a few slides here now. All right, Amy, can you see that? Okay, great. All right, so for those Nursing Now who are familiar with Nursing Now webinars, you may have seen a couple of these slides before, so apologies in advance if you have seen them. I'm going to talk a little bit about the importance of health workers and health workers' voices in particular in addressing what is really a crisis right now of some of these backslides in immunization rates that we've been seeing as a result of the COVID pandemic. And of course, just to start, I think probably anybody on this webinar doesn't need to be told of, but just a couple of facts here on just the profound impact that vaccines have already had and can have. In the vaccines that just went into arms in the first 2 decades of this century and across 112 low and middle income countries, those vaccines are already estimated to prevent 50 million deaths, an astounding number. Vaccines have long proven to be one of the most impactful public health interventions that there are. But of course, doing so requires those vaccines to be into arms. In the first year of distribution, COVID vaccines saved nearly 20 million lives. In a second, I'll talk a little bit more about the inequity of that benefit. But a massive, the biggest rollout in human history of a vaccine led by health workers saved nearly 20 million lives in a single year. And of course, these vaccinations are hugely beneficial on the financial end and on livelihoods and on economies. And so just in low and middle income countries in the previous decade, it's estimate that every dollar spent on vaccinations in those countries yielded up to $52 in savings, from lost wages, lost economic productivity, and of course on health costs. Of course, when we're talking about COVID, we all know that benefit from that was inequitable. The UNDP estimated that more than $16 billion, more than 5% GDP increase could have occurred in low-income countries last year if vaccines had been equitably distributed. And it could have and a recent analysis just out modeled that it could have potentially prevented 1.3 million more deaths if they had been equitably distributed. So now on top of that, we have the residual effect of the pandemic was not just on COVID vaccinations. It's that the WHO and UNICEF have found that in the last 3 years that there is the longest sustained decline in routine childhood immunizations in about 30 years, with 25 million infants, young children missing out on life-saving vaccines that they were supposed to receive last year. And that is 6 million, that 25 million is 6 million more than missed out in 2019. And around 18 million of those 25 million children who missed out on vaccines last year did not receive any vaccines at all. Have not received any vaccines at all. They are what are called zero-dose children. And of course, to reach these children, it requires a lot of arduous work by health workers and predominantly nurses and midwives to reach these children. And so that zero dose of 18 million is increased by about 5 million in the last since the pandemic started. And so there's really a huge burden, as we all know, in many different areas, but it's certainly in vaccination on health workers to catch up kids who miss vaccines, to reach these zero-dose children, and to save lives. And this is just to say this decline has occurred. These are the WHO regions. A decline has occurred in every region of the world. So it's not specific to one region or another. But at the same time, we have seen just in this past year, some countries who have really focused on their health workforce, on the community-based interventions, have really had a bounce back. And so there's a real opportunity, especially for health workers, to share their experiences and their voices to this, that there is a real opportunity to catch up these rates and to really have a profound impact in saving lives over these next couple of years. And I don't need to tell this group this, but health workers are, and especially nurses and midwives, are continually at the top of the charts in terms of who are the most trusted people with health information. This was a Wellcome Trust survey from 2020, and it had this inclusive of doctors, but of course nurses and midwives we've found at the other surveys have found at the top of the charts in terms of who is the most trusted professionals to deliver health information. And so it matters, of course, for communities, but it also matters for for advocating for the investments that health workers need and investments in them that are necessary to deliver vaccination. And this is just a quick slide to show that the shortage of health workers is expected to decrease in the next decade. But the share of that burden of the shortage is expected to increase in a couple of regions, Africa and the Eastern Mediterranean in particular. And so, this recent study from the World Health Organization found that $6.5 billion needed to could achieve the 70% vaccination coverage of COVID vaccines across all regions. But that is a lot of money, $6.5 billion, but comparison to the billions and trillions that have been lost economically as a result of this, that investment is hugely impactful and beneficial in terms of both achieving vaccination targets and then averting all of the economic costs that would result from not reaching these targets. So the last thing I will say until I turn it back to Amy, who will then turn it over to Sam on People Power Health, is just that this group of Nursing Now immunization advocacy champions has made a profound impact in advocating for those investments in health workers, for those investments for advocating both locally and globally for immunization. And so these are just a few photos from that. One of the current champions, Rose Nakame on the left, talking to the First Lady of Namibia. In the middle there is another one of the champions, Rashid Manganda, talking to the head of Gavi, the Global Vaccine Alliance. The one on the top right is three of our nurses, Mpo, Rafiat, and Mohammed, at a summit talking to the head of the International Council of Nurses, and then of course Amy there at the bottom delivering a speech at the UN General Assembly. So they have all spoken globally. They all have also acted locally to convince folks in their communities to keep up on both their routine and COVID vaccinations. And so, Amy, as I turn it back over to you, just to say that this group just been very inspired by what this group has accomplished in just a very short time. But I think just those slides reiterate how important it is that health workers raise their voice in the coming year with the way that these the trends have been in the next couple of years. Amy, back over to you.
Thank you so much, Vince, for your kind words, for all of your hard work, and for amplifying our voices and driving change through all of your advocacy. It's so crazy to think that just last year we began our own initiatives with these incredible individuals that you're hearing from today. Advocacy activities that included educating communities that we call home, empowering healthcare workers, and ensuring accessibility to vaccines for all, even if that required trekking through rural areas with coolers, as Rashid does, traveling by horse, as Mapo does, to reach those who need him most. Sometimes our activities involved speaking with policymakers as well, as my colleague Rafayette spoke at the White House Second Global COVID-19 Summit. My colleague Rose, who has spoken all over the world, most recently in Berlin, and also requires speaking with our community, just as my colleague Mohammed strives to meet individuals where they are within the community. So each of these activities require one single thing, and that is your voice. We learned to use our voices thanks to an incredible organization that guided the way, People Power Health. People Power Health is here today to speak with us. We have the incredible Sam Gonzalez, project manager of People Power Health, to talk to us about using our voices for change. So thank you so much, Sam, for joining us.
Thank you, Amy, for that incredible intro, and thank you to all the team for this invitation. And thank you everyone for joining. I will be sharing my screen right now. Is that okay? Perfect. So first of all, thank you for this opportunity of being here and allowing me to share a bit of our journey of how using your voice for change is a key opportunity that we can have. As Amy told, my name is Sam Gonzalez. I am a physician, and I am currently working with the amazing team of People Power Health. So first of all, I would like to share my story and share a little bit of my voice with you as an example of what sharing the voice and the public narrative framework can achieve. It's December of 1996. I am visiting my grandparents in their small rural town in Mexico. And you can see a picture of my grandpa over here. He was a really serious man. He didn't smile a lot, but we all knew that he loved us a lot. In that moment when we are visiting, we have Christmas lights, we have Christmas carols, and suddenly that night before Christmas, we could see how my grandpa was feeling a little bit unwell. He had, first of all, a headache, and then minutes later he passes and he loses consciousness. We start looking for some physician or nurse in the town that could help us know what was happening with him. And at that moment, we were not able to find anyone because they told us it was holiday. After over an hour of trying to figure out what to do, we moved him and get him back to the capital city, to Monterrey, and we were able to find a hospital that told us that he was suffering a stroke. At that moment, we were all concerned of what was going to happen. Later on, we learned that he was going to be in a bed for the rest of his life. And one of the things that I started to ask myself was, why was it that people in the rural parts of Mexico were not able to find quick help when they needed it? 7 years later, I was able to start medical school, partly inspired by this need that I could see, that I could find. But at the same time, when I was in medical school, I noticed and I learned that not everything on healthcare was related to a drug or to a hospital. There were other determinants that were really important. And in that moment, when I was figuring that out, I also got a diagnosis myself. I got a cancer diagnosis myself. And in the middle of those moments, I realized that problems with healthcare access were not exclusive of only the rural part of my country, but also in the urban part of the country, in the big cities, there were limitations about who could get access to healthcare and how that could be done. After a couple of years, well, I finished chemo and then I finished medical school. And after a couple of years, I was able to start an organization that promoted that people could donate blood in a voluntary way. And we could achieve this by organizing in our own communities, talking to some neighbors, talking with some friends, and organizing in order to be able to achieve that change that I wanted to see in my community. People that could have a better access both to healthcare and to, in this case, blood donations. So this is just really a brief example, a brief story of how sharing this voice, sharing these stories that we all have can definitely move people and make people realize some of the examples that we can do and we can achieve, some of the change that we can achieve. So I would like to start also by sharing that leadership has several different definitions that you may have heard, but there's specifically one definition that we at People Power Health love and that we would like to share with all of you, is that leadership is accepting the responsibility for enabling others to achieve shared purpose in the face of uncertainty. And we are all clear how these last years, these pandemic years, are a clear moment of uncertainty. People sometimes don't know what to do, who to believe, who to trust when they are listening to different to different stories or different comments about what's happening next. And that's why one of the things that we agree on is that this is a very important skill that we need to learn. And storytelling is not just about telling a story and that's it. Storytelling is a leadership skill. And as a leadership skill, it's something that can be learned and that can be practiced. Now, there is a certain model of leadership that we at People Power Health and with the Sabine team, we realize that it's definitely much better than the traditional hierarchy of top to bottom that we are used to see or to learn in different places. And this is the interdependent leadership model. It is a model where people organize between themselves and then with their community members so that smaller teams can organize between them and all of them have a direct opportunity of achieving change and of expanding within their community. So this is the interdependent leadership model that we at People Power Health are promoting and are convinced, and we share this with all of our colleagues and fellows. But also an important part here is that as healthcare professionals, we know that there are several things that need to happen for people to take action and not just to imagine change, but to do it. First of all, it's the strategy part, the head, we call that. And that could be data, that could be different kind of information and the analysis of that. And that is a first step, and that's really important, but that's not enough. We also need to relate to the heart, to the narrative, to the emotions, and how that can motivate people. So that when we put these two together, the strategy and the narrative, the head and the heart, we can achieve action, okay? We can put our hands into action, and this will lead to this shared understanding of how the strategy and the narrative came together to achieve action and to achieve change. Now, another piece that is really important is how the public narrative framework works. And it's composed of three parts. It's the story of self. Why do I care about this? And it's a call to leadership. And that also relates to the story of us as a community, how we share values, how we share experience, and why we as a community need to care about this. And the third part is the story of now. And the story of now is related to the question, why now? Why do we need to change this topic now and not later? And this is where the urgency comes in, and we need to start thinking about strategy and about action. And those are things that we are gonna be seeing through the course. Now, this is really important, and I love this picture because when all of us start to see or to learn about bicycle, we are not taking a course or a video about bicycology. That's not gonna happen. We need to go and sit ourselves on a bike. And when we are on a bike, we need to practice. And maybe we will fall sometimes, but we will get on that bike again and we will continue practicing. And that's definitely something that we need to realize, that public narrative is the same. We are not gonna get it excellent the first time. We will need to practice, and get on the bike once and again. Now, our journey will last several weeks. We will be talking about some of these elements: story of self, story of us, story of now. And we will be also having 3 training elements that are really important, okay? The first one are some micro lessons of EDAP. This can be done on the mobile, either online or offline, and it will take around 2 or 3 hours a week. Then we have the live sessions through Zoom that will be one session of 90 minutes per week. And this is really important, coaching and practice. As much as is needed, we will have coaching and practice with a cohort so that everyone can feel comfortable working with their public narratives. So this is a brief overview of the work that we do, and I will give it back to Amy so that we can follow with the next part of that webinar.
Thank you so much, Sam, for sharing and for sharing your own amazing story with us. You are the most incredible physician, advocate, and human, and we are just so lucky to have you supporting us as we share our own stories. The stories of the individuals who joined us today are powerful. Today, we've broken up these tools into 3 breakout rooms for each of us to take part in. So first, stakeholder mapping. COVID was a wake-up call for politicians and government officials to listen to nurses when it comes to driving policy change and healthcare protocols. We woke these politicians up, and now that they're awake, we need to make sure that they don't fall back asleep. There couldn't be a better time to locate the stakeholders who hold the power to make change. So how do we reach them? We'll talk about that in our breakout session number 1. Number 2, framing the issue. How do we strategize to frame our issue into a story that reaches everyone? And 3, using your voice. Some professions follow history. Nurses, on the other hand, write the future. And I think that we'll see a lot of that in our breakout sessions today. So as we break out of silence and into these rooms, we'll begin to tell your stories. We do invite you to click the link in the chat, which will take you to your breakout session. This link will take you to a different Zoom meeting. And at the conclusion of our breakout sessions, we'll all join back here together to share with one another. So please go over to the chat box. Feel welcome to click on that link and join us in our breakout rooms.